Welcome to Dr. Martin, Head and Neck Radiology. In this video, we will review the radiologic features of pleomorphic adenoma, the most common benign tumor of the parotid gland. The goal is to provide a clear, structured, and practical overview for radiology residents, practicing radiologists, and healthcare professionals who want to strengthen their understanding of salivary gland imaging. Our first case involved a 67-year-old woman with a long-standing, painless mass in the right cheek. A contrast-enhanced CT scan showed a well-defined lobulated lesion in the superficial lobe of the right parotid gland. It demonstrated heterogeneous enhancement without invasion of adjacent structures, no extension into the deep lobe, and no associated lymphadenopathy. Histopathology confirmed a low-grade pleomorphic adenoma. The second case is a 47-year-old woman with several years of a palpable, painful nodule in the left cheek. Contrast-enhanced MRI demonstrated a well-defined, lobulated mass in the superficial lobe of the left parotid gland. It was hypointense on T1, hyperintense on T2, and showed homogeneous enhancement after contrast administration. There was no extension into the deep lobe and no lymphadenopathy. Histology again confirmed pleomorphic adenoma. Pleomorphic adenoma, also known as benign mixed tumor, most commonly arises in the superficial lobe of the parotid gland. When small, it tends to appear round or oval. As it enlarges, it often develops a characteristic lobulated shape. In deep lobe tumors that extend through the stylomandibular tunnel, the mass may assume a pear-shaped configuration and displace the parapharyngeal fat medially. On CT, small pleomorphic adenomas usually appear as well-circumscribed masses with homogeneous post-contrast enhancement. Larger tumors frequently demonstrate heterogeneous enhancement due to intratumoral necrosis, areas of hemorrhage, or cystic degeneration. Dystrophic calcifications can also be present, especially in long-standing lesions. MRI provides superior soft tissue characterization. Pleomorphic adenomas are classically hypointense on T1 and markedly hyperintense on T2, sometimes showing extremely high T2 signal intensity, which is considered highly suggestive of this diagnosis. A thin, low-signal capsule on T2 is often visible. Larger tumors may show heterogeneity from calcification, hemorrhage, or necrotic areas. Post-contrast enhancement can be homogeneous or heterogeneous, depending on the internal composition. It is important to recognize imaging features that are inconsistent with pleomorphic adenoma. Tumors with poorly defined margins or low T2 signal intensity should raise concern for malignancy. Facial nerve palsy is also uncommon in pleomorphic adenoma and usually suggests a malignant process. Clinically, the presentation depends on the location of the tumor. Lesions in the superficial lobe typically manifest as a painless mass in the cheek, while those in the parotid tail often present as a non-tender mass near the mandibular angle. Deep lobe tumors may displace the palatine tonsil medially, producing a parapharyngeal space mass effect in large lesions. Facial nerve paralysis is rare and should prompt suspicion for malignancy. Pleomorphic adenoma occurs more frequently in women, usually between 30 and 60 years of age, and surgical excision is generally the treatment of choice. Differential diagnoses include Warthin tumor, mucoepidermoid carcinoma, adenoid cystic carcinoma, intraparotid lymph node metastasis, non-Hodgkin lymphoma, and intraparotid facial nerve schwannoma. Correlation with patient age, clinical history, and lesion location, along with CT and MRI signal patterns, helps narrow the possibilities. From a pathological perspective, pleomorphic adenoma contains epithelial, myoepithelial, and stromal components, often surrounded by a fibrous capsule. Areas of hemorrhage, necrosis, hyalinization, and calcification may be present, particularly in long-standing tumors. Without treatment, malignant transformation can occur in up to 15% of cases, underscoring the importance of timely surgical excision. Before continuing, I invite you to watch another video on this channel about the carotid body tumor, where we review characteristic imaging findings and diagnostic pitfalls. I will leave the link for you in the comments section. Thank you for watching this educational review on pleomorphic adenoma. If you found this video helpful, please subscribe to Dr. Martin, Head and Neck Radiology, give it a like, and leave a comment below. Your support helps us continue producing high-quality, educational content for the radiology community.